The student loan conversation is incredibly loud right now. It's been loud for weeks. And if you haven't heard the student loan conversation, then I would argue you're not paying attention to the news, because there has been a polarizing fight over who in the world is responsible for student loans. And student loans is the phrase has become so vilified. And I'm not going to sit here and stand up for the idea of student loans or whether or not students should sign off on them or they should be allowed to accrue so much in debt for a career. We're going to talk about that over the coming weeks. But the idea of student loans and who's responsible for it has become so polarizing. Politically, it's divisive. It's another topic that's pushing one group towards one side of a party and another group towards another side of a party. And anger stirs at the government and anger stirs at who's responsible, when ultimately, who is responsible? Right now, we sit at around $1.8 trillion in student loan debt. That's after some has already been canceled and forgiven based on terms of public service and attending a for-profit institution that might have not been on the up and up and has since closed, and the government has canceled and forgiven some of that. And those costs have to be borne by somebody. The taxpayers are having to pay something. Somebody is having to pay for this. And so the government and the politicians on both sides are using this as leverage for a certain cause. They're using it as protection, using it as one side is going to keep this from happening again, and the other side says we're entitled to pay for this. Then each side says, no, it shouldn't be this way. Yes, it should be this way. No, it shouldn't be this way. Yes, student loans should be canceled. It's legal to cancel them. And there are a lot of issues in this idea of student loans and student loan debt and who's giving them and why they're giving them and who they're giving them to and what's it actually doing. There are going to be conversations over the coming weeks where we talk about what student loans are doing, but we're going to put it into a context that is healthcare specific, but not just for healthcare students and workers. I'm Cody Thompson. I'm the founder of what is called Project 2 Million. And so this is the first episode of the Project 2 Million Healthcare Student Loan Podcast. I created Project 2 Million to help change generations, to flip the script on people that want to go into healthcare, that are called to care for the health and healing of others, but they're carrying such a debt burden, such a loan load, if I can call it that they're actually not able to thrive in caring for themselves. What that's causing is an impact on patient care. It's causing burnout. It's causing a myriad of issues that we're going to talk about along the course of this podcast. So in this first episode, let me introduce what Project 2 Million is, what the purpose of it is, how this loan conversation and what is student loans should be canceled and forgiven, or whatever you want to call it, but from a completely different perspective. And that's my argument today. And these are 4 tenets. There are 4 tenets of Project 2 Million that we'll go through. Is that student loans, the forgiveness, cancellation lies in the hands of somebody else, not the government. And it requires these 4 things. It requires us to redefine success. It requires us to redirect focus. It requires us to improve our stewardship. And then we change generations. Welcome to the Project 2 Million podcast. So all of this is going to be put into the healthcare context. As I mentioned before, my name is Cody Thompson. If you missed the introduction, I'm a physical therapist by trade. I'm a licensed PT and have been for 18 years, a little over 18 years at this point. And things have changed so much in my profession that The degree has changed in particular to get into my profession. The profession itself looks so tremendously different from what we're able to do, what we're skilled to do, but also what salaries look like, what the job market looks like. When I went to school in 2003 and 2004, I graduated with a master's degree. School was about a third, maybe 50% of what it costs now, and it is now a doctoral degree, the DPT. And lots of healthcare professions have pushed for this greater amount of school to improve their ability, first of all, to look as if they are a doctoring profession, not to um, not to undercut a physician, but to be closer to being a primary care provider than any other. And so the cost of education is higher since I was in school. The type of practice is far different. What hasn't changed, and this is not just PT specific, is what salaries look like. So let me give you a very brief example. And again, I'm comparing right now in 2023 to what I used to do in my profession. I worked in 3 different settings before I got into teaching, and teaching is where I am now. I teach at a local university here in Alabama, and the education is different. It's about at some schools it's doubled for salaries that have not doubled. In some cases, salaries have gone down. What that looked like for me was when I got out of PT school, I did a horrible job doing my homework, but this was 2005 January of '05 when I got my license, and I did a little bit of homework, but not enough. And I knew in my heart, all I wanted to do was sports, and I wanted to work with athletes because I was an athlete and in high school. And so all I wanted to do was I wanted to own my own clinic, treat athletes, and eventually I was going to go work in the NBA because I loved basketball. And so that did not work out because 4 weeks into my first job, after choosing a not great experience at a clinic here in Alabama, and I was completely burned out by 4 weeks, I was so anxious to get out. I was desperate. Like, this is not what I went to school for. Please don't tell me this is what I went to school for. And so I shifted into something that really was just chasing a paycheck. I got a 25% pay bump. I made $47,000 with a master's degree in 2005 in PT, working in outpatient orthopedics. Went up to around 60 to work at a skilled nursing facility, which was huge for me. It allowed me to buy a new vehicle, to save for a house. It was great. I worked for a year in that skilled nursing facility and learned so much. Fell in love with the geriatric population, which I never thought I would do. And that allowed me an opportunity within the same entity to work for a home health agency that this company also owned. And when I got into home health, it was like, whoa, I get to see all the patients I want and get paid per patient, and I get to travel wherever I want, and I get to ride in my car and listen to the radio all day. And I get to like geek out on the challenge of, oh, this is going to be super cool because all these patients are so complex. It's not just a rotator cuff repair, that we're doing the same exercises over and over and over. And that was what life was to me in outpatient. And I had learned some in skilled nursing about wound care and the complexities of these neurologic populations with Parkinson's and things like that. So super neat. That completely all fit my niche way more than I thought it would. So I got into home health, and I got up to making more to where I was making within 5 years of graduating, I was making $115,000 a year. And now making $115,000 a year, I would have to be working about 30% more, maybe 40 for the same income, covering a larger area, driving around more. If I was working in an outpatient clinic, I would likely have to be, I can't even imagine the productivity that I would have to meet, or what type of clinic or multiple clinics I would have to be managing just to be able to make that type of income. And so the hours start accumulating, the fatigue starts accumulating. And so now we sit in 2023, when this is just for PT, but that I'm speaking to because that's all I can speak to. But in my career, I have overseen state the home health agencies for the state of Georgia with a certain company. I have overseen education in healthcare for the state of Alabama community colleges. I have overseen academic programs. I've taught in them. I've developed them. Some failed, some successful. And what I have seen across the board are a few things. One, that there is very little gatekeeping other than these programs, these healthcare programs being selective in mission. You have to meet a minimum requirement of a GPA or a science score or writing and at your your writing skills to write an essay. There's lots of different metrics. But there's very little gatekeeping on who is actually aware of what it costs to get in. And so here's what I mean. In my career in teaching, I have worked at multiple types of institutions, one of which was a faith-based institution, private school, doctoral level PT program, taught in it. The cost of that program was $100,000. Knowing that students were going to get out, and this is on top of their undergraduate tuition, and assuming they weren't paying for this out of pocket, didn't have a scholarship, something like that. So they were paying $100,000 just in tuition, not including living expenses, not including textbooks, not including any other, food, groceries, whatever they're taking out of their loans. And so students are graduating with 150, 175, some close to $200,000 in debt, not realizing, for one, that it was going to cost that much, and two, what their salary was going to be when they got out. They had no idea. So when I was in school in 2004 and I was getting out, coming into the workforce, there were so many fewer resources to find out salaries, company reviews. The internet existed, but there actually weren't smartphones. There were no apps. There was nothing like that to give people access to what they needed to say, oh, okay, well, I'm going to go to school. I'm going to get this career. I'm going to get out and make this much money, and this is where I'm going to live. And it's going to cost this much. Nobody did that math. So when we had conversations with students, and it was mostly me, because I started looking at something isn't adding up with the math here. It was I didn't actually realize I was going to be in this much debt. How much should I ask for when I get out and go to my first job interview? And that's a scary conversation to have. Go to a public school where the tuition is about 40% less for the same degree where I taught, and had the same conversations with students there. And it was, I'm probably going to be about $110,000, $120,000 in debt. I didn't realize it was going to cost me this much. And wow. So what are you going to do? Where are you going to live? Where you're going to get your first job? Well, I'm going to have to get a job close to where I grew up, because I'm going to have to live in my parents' basement for a few years until I can get on my feet financially. And so you start seeing how the problem affects people's lives literally on the ground, and how these students had no idea. And so this fleshes out as students who go into a workforce underpaid and overworked, and they become so burdened with this issue, student loans, that it's affecting their mentality, their emotional stability, their ability to provide quality patient care. It's affecting burnout rates astronomically. It's even affecting, research is showing, what specialties students are going into when they graduate, whether or not they do a fellowship, whether or not they do a residency, whether or not certain students get a certain type of care, or patients get a certain type of care. And so here's an example. And remember, the context of this is also, this student loan issue is also coming within, so COVID-19 highlighted the need for healthcare professionals. They were deemed heroes to a degree. And I say they because I am a licensed one, but I rarely practice anymore. I teach mostly. And so I'm seeing the side of the cost of education and what students are making coming out. Here's an example. The average burnout rate in healthcare professions is about 3% every year. And you think that's not really high, but in the United States, we have around 21 million healthcare workers currently, somewhere between 21 and 22 million healthcare workers. There is a need for more in almost every field. I think the lowest ones are pharmacy and dentistry maybe, but there's still a need. and that will grow because the population is aging. 3% of the healthcare workforce is burning out, completely leaving their professions that they went to school for. I have no idea what they're doing with their debt unless they're filing for some forgiveness program, or I don't know. There are a few options, but not many. For PT, for my profession, the burnout rate is at 9%. So 3 times the national average for healthcare. So we sit in this really weird spot, and it's not a good spot to be in, but students don't know it, that the burnout rate is true. It's close to 10%. So for every 1,000 PTs there are in a state, 100 of them are burnt out by the end of a year. And they don't realize that they are likely getting into a cycle that is going to be where they are underwater for a large part of their life. And so there's going to be and there already is this shift, this almost like an economy shift in the workforce to where the need for healthcare grows. Reimbursement recently, prior to this podcast and around the time of this podcast, has shifted so much. It's declined. So the salaries that used to be, again, 115 are now somewhere between 80 and 90 in the same setting, same profession, same geographic location. Not quite as different in skilled nursing and outpatient because of productivity increases. So students get out and it's immediately, I've got to be seeing X number of patients a day, which is 30% higher than they would have if they would have graduated 10 years ago. And so it becomes exhausting. Caring for somebody else's life is exhausting, especially when you do it 40, 60 hours a week. Paperwork is going up. You're not paid for paperwork time. So people in healthcare are now spending extra hours doing paperwork. It's not a good cycle, is it? So we're setting students up for this environment and this situation and assuming they're taking loans out. Well, why? Why are we doing this? Do we ever stop to think maybe it's somebody else that should be responsible other than the government? Does the government really need to erase the debt that I should have been aware of going in? What if I would have done my homework? Why did I go there to begin with? Students are going to college because it's almost like they're forced to, not really forced to, maybe I shouldn't say that. That's harsh. They're going to college because they feel like it's the thing to do. And why do they feel like it's the thing to do? It could be because of pressure from peers. Hey, where are you going to college? Where did you get in? What's the other side of that? Being extreme, but hey, I'm going to go, well, what are you doing after school? I'm going to go be an influencer. I don't know. Some people succeed at that. But for the most part, there's this weird expectation of, well, I got to keep going. I got to go to school. Okay, well, for what? Good for you. Well, I don't know. I'm going to spend a couple of years figuring it out because that's what people do. They jump into college and they go to the first 2 years, hopefully if they make it, and they somehow think they're going to find their way. And so well, I'm going to pay for something along the way until I figure out my niche, and then I'll dive in. That's what I'm going to do. And so now we have the students jumping into undergraduate school, knowing that there's really I shouldn't say zero, very little value in an undergraduate degree at the time of this recording. The value add of a graduate degree, especially in healthcare, but in other ones also, is so much higher, and it sets you apart, even though there's still competition at those levels. And also associates or trade or technical degrees are so high value and so low cost and so quick to get. But students get in thinking, well, I'm going to do this for a couple of years and figure it out. And then they get into something that looks cool or is trendy, or I can wear shorts and a tank top or leggings or whatever. Or I can go somewhere and be in some honor society and dress up and with like the cross with the snake around it. And so I can say the Hippocratic Oath and I'm going to med school. And Um, whatever. That's where I need to go because that's what's smart. That's what makes sense. That's what's successful. And that's the problem. That is the one core problem is the misguided version of success in society today. So me as a parent to 5, and I've worked in community colleges and I've worked in grad schools and universities and developed courses for universities and have these behind closed doors conversations about what the workforce looks like. I used to work in workforce development for the state of Alabama in healthcare. People don't realize how much they will spend if they go to a graduate degree program, healthcare or not, but specific to healthcare. They don't realize how much they're going to spend. They don't also realize the inverse, the converse of, hey, this is how much I can make if I do this through an associate's degree level. And wow, there's actually grant funding to help me pay for this, so I can get a job in 2 years. And here's an example to put this money thing into context and the success thing. So when I got out of school, I made $47,000, master's degree. And within 2 years ago in central Alabama, where I live, and I was driving down the interstate and I saw a billboard for a community college I used to oversee, and it said, become an LPN, make $47,000 a year. And it struck me, wow, that's how much I made with a master's degree. And yes, there's inflation, but an LPN, I could have made the same money in 4 terms of school instead of 6 years. That's quite a difference. In my profession alone, the average student debt for PT students is $146,000 for a median salary, not new grad. Right. And in our location, it looks like around 80, 85 in outpatient orthopedics for PTs. PAs come in just over 100, somewhere around 115 with a median of about 125. Nurses can easily make 60 to 80, depending on where they go. But nursing is a little different. We'll talk about that later. So I can go to school. I can be $146,000 in debt, make $80,000 a year. And so you could calculate it. You can run the payment calculator and see what that looks like. Now compare it to the associate's degree level equivalent. And you could do this for a BSN or an RN also. And we'll do this. This is what we do in our course, in the Project 2 Million course. The link is down below to the course and to the website. You can sign up for the weekly newsletter where we talk all things cost, college, and career related. PTA, that's the associate's degree level. Get out and make anywhere between 40 to 75, depending on what setting you work in. But you paid likely only 9 to 10 grand for that degree, depending on the school. Some states even less. That's Alabama's cost. And places like New Mexico and California have astronomically low community college costs. So I make $50,000. I paid $6,000 for my degree. Where's the better return on investment? Especially when I know I can get into a field, see what it's like. And if I want to go back and further myself, I can always do that. But we've misguided success. We've said, you've got to put these letters behind your name. You got to get this title. You got to be one of, 4 or 5 things. When I was growing up, you got to be a doctor, a nurse, a lawyer, an astronaut, or a teacher. And I guess I'm a teacher now. But the definition of success was created by somebody else, and it just as if it was some cultural thing. So what is success? That's the first part of this journey, whether you're a parent watching this or you're a student that's watching this and you're thinking, okay, I'm going to get into healthcare. This is my path. Do the math and see what the cost is. See where it lands you. See what there are all the tools in the course. Do all the homework you can, but ultimately you need to define success for yourself. Is it wealth? Do I want to be at a certain income level? Do I want to have a house within a certain number of years? Do I want to be financially independent and own real estate on the side of my gig? Do I eventually think I want to be a mom, just a stay-at-home mom? I shouldn't say just a stay-at-home mom. My wife is a stay-at-home mom, and she homeschools our 5 kids and she works until she sleeps. What's my goal, and how am I getting there? But first, what is success? And am I defining it for myself? Am I following the people in trendy clothes and trendy clubs? And well, I've got to have a GPA this high, or I've got to make this amount of money, or I got to have letters behind my name because that's success. And that was mine. Not to have letters, but that was what I was pushed towards by my family. My father in particular, who had a PhD in microbiology, and he just kept saying, if you just need to get a PhD, you have to do that. And the whole time I'm asking why. That doesn't help me. I don't need the letters behind my name because I don't need a degree for people to respect me or to be successful. It might be early on to think about your why and what's successful to you. But I also want you to, and while you're writing your definition of success down, write down what you would do in the meantime if you didn't go straight to college, or if you stopped for a while. As you rethink, what am I doing here? Think about what your options are. Who have you talked to? Do you have wise counsel? Are you better off being an entrepreneur? Questions to ask yourself, because chances are you have something better than what everybody else is defining for you as success. You have gifts that made you designed for what the Bible calls in Ephesians 2:10, good work. You were good work, created for good works. So as we wrap this episode up, and again, subscribe, check out the course from the link in the description down below. We're planning on changing the course of healthcare by redefining how we get there. Thanks for being here.